There's a lot of confusion and noise out there regarding the coronavirus, now officially called COVID-19. And I want to go ahead and try to separate the signal from the noise. What is really true here? What do we know and what don't we know? Should we be worried, or are we all just caught up in hysteria? Like with my first video on COVID-19, which I made about a month ago when news of the virus first started to become widespread, my goal in this video is to leave you with a sophisticated and clear understanding of the predicament that we find ourselves in. If you haven't seen that video yet, I encourage you to pause here and check out that first video where I explain what COVID-19 is, what its symptoms are, how and why it kills people, and how you might be able to protect yourself from it. Hey guys, my name is Atif Shahnawaz. I'm an internal medicine doctor, and in this channel I explain medical concepts in an easy-to-understand way for layman people. Please click on that subscribe button if you'd like to get more content from this channel. Now, there are just two factors that are going to determine the impact of COVID-19, and if we focus on just these two things, we should be able to cut through all the noise and chatter and be left with an accurate snapshot of the situation as of early March 2020. The first factor is the contagiousness of the disease. In other words, how easy is it to spread from person to person? And the second factor is the mortality rate. How many people end up dying of this disease once they are infected? Now, everything that they're discussing on the news about the impact of the disease really reduces easily to just these two factors. So let's explore what we know so far about these two variables. You'll read and you'll hear about many factors that affect the contagiousness of this disease. You already know, for instance, that it spreads via respiratory droplets or via infected surfaces that are touched by other people. This means that a person can be infected from a distance, or that an infection can even spread from a contaminated surface like a table or the handle of a door or eating utensils, so that two people don't even have to be near each other to cause the spread. Now, there are also some reports that an infected person can cause the spread of the disease while being completely symptom-free. But the only really important thing that you need to know here about COVID-19 is that it has spread around the world in just a few weeks. And in my opinion, this tells you all you need to know. It's pretty contagious. Now, when I first made my last video a month ago, the only way that patients were being screened for the infection here in the United States was to ask them if they recently traveled to Wuhan, where the infection first began. Now, just a month later, that is completely irrelevant. The disease is now present in dozens of countries, and this spread has occurred very quickly. For me, the tide on COVID-19 turned when we discovered that the outbreak had reached Iran. Before Iran, the countries that were affected were all relatively affluent countries with governments that could mount robust efforts at containment. So China, South Korea, Japan, and Singapore were the first countries affected. But when it reached Iran, that was no longer the case. The extraordinary steps that China was taking to contain the infection simply could not be replicated in a country like Iran. The Iran outbreak told me that efforts at containment had failed, and that this virus was going to be with us for a while. Because of the way this virus spreads, areas where people are not likely to isolate themselves or areas where people live in close proximity are extremely vulnerable to spread. So densely populated areas in Southeast Asia like India, Pakistan, and Indonesia are particularly vulnerable right now. But eventually, the virus will spread to other densely populated areas all over the world, from Hong Kong to Cairo to New York City. So in terms of contagiousness, I would say that COVID-19 has demonstrated itself to be very contagious, and efforts at containing the virus have not worked, and they're not going to work. The spread of this virus is something that is no longer in our control anymore. This is going to play itself out, and there isn't much we can do about it. Let's get into the second factor, the mortality rate. What is the probability of someone dying if they catch the disease? Now, I'll answer this question right off the bat and tell you that we don't really know yet. And let's examine why we don't know. The mortality rate is the number of deaths divided by the number of infected people. And while the number of deaths from COVID-19 is a reasonably accurate number, the denominator, which is the number of infected people, is currently a giant question mark. Why? Well, the main number one reason is that we don't have testing kits fully rolled out yet. Because in order to make the diagnosis, we have to be able to detect the virus in the lab. Governments around the world, including the United States, have not been able to ramp up testing kits as fast as the infection has been spreading. Now, there is a very good chance that the actual number of infected people worldwide is much higher than the officially reported numbers, and that is because we just haven't scaled up our testing capabilities. I know that many countries are making efforts to have testing become available, but I want you to appreciate the logistical challenge of making hundreds of thousands, if not millions, of test kits available to most major hospitals in any particular country. And in poor countries where healthcare resources are scarce even before COVID-19 occurred, these test kits might never be scaled up in large enough numbers to truly capture all the infected cases. So this is why the mortality rate is a difficult number to know for sure. Now, with that disclaimer out of the way, I will tell you that the data set coming out of China so far is the largest that we have to examine. And by the end of February, the Chinese Center for Disease Control and Prevention released a detailed breakdown of its numbers. And by then, China had counted a total of 44,672 confirmed cases with 1,023 deaths, giving COVID-19 a mortality rate of 2.3%. And a week later, the World Health Organization stated that it's estimating the mortality rate to be around 3.4%. Now, if you're wondering if these numbers are high or not, let me tell you, yes. For a contagious disease like coronavirus, these numbers are very concerning. Now, I want you to appreciate that over the next few weeks, you will hear different mortality rates coming out of governments and healthcare organizations, and this number will continue to be revised as more testing kits are rolled out and the true extent of the disease burden is revealed. And this is not because healthcare professionals don't know what they're doing or they're lying. It's only because this number is bound to be a moving target as more data comes in. But if these initial estimates are even approximately correct, then this news is very grim indeed. Now let me explain why. What we don't also already know is how many people in the world will be eventually infected by COVID-19. Will it be 10% of the world's population? 1%? 50%? I don't know, and no one else knows either. This is a really impossible thing to predict right now, and we will only really know when the situation plays itself out. But the closest experience that we have to something like this is the 1918 Spanish flu. And that was estimated to have infected 1/3 of the entire world's population at that time. The Spanish flu killed 50 million people, and that occurred in an age without mass transportation and an age where most of the world's population did not live in densely populated cities like they do today. So for the sake of argument, if we assume that COVID-19 will infect the same proportion of the world as the Spanish flu, and if we assume that the mortality rate is, say, 2.5%, then the final death toll still comes out to 65 million people. Now, I want to be clear, though, that this number rests on a lot of assumptions about the mortality rate and the extent of spread. Two variables which we currently don't have complete knowledge about. But I hope you appreciate that the picture thus far of the extent of spread and the estimated mortality rate is concerning. The long and short of it is that the worst case scenario that tens of millions of deaths will occur is a viable possibility. It is not drummed up hysteria by the media. But while it has a real chance of happening, what no one can say for the moment in early March of 2020 is how likely that is to occur. But it is a non-zero, non-trivial probability. Now, in the weeks to come, we will see the number of confirmed cases of coronavirus skyrocket. And I want you to understand that that doesn't necessarily mean that the disease is spreading faster than before. It just means that we're testing more and discovering more cases. My sense is that it will take probably another month or so before we really have a good idea of what the rest of 2020 holds for us. The month of March will mostly be a month to gather data, and then that can be used to make some predictions about the future. Right now, while this is serious, it is impossible to know how serious things are going to continue to get. There's also another unavoidable dimension to this that I feel I should mention, and that is the effect this outbreak is going to have on global geopolitics. Firstly, as I've stated, containment of this virus is impossible. If China couldn't do it by closing off 50 million citizens in their cities, then no government has a chance of containment. Secondly, because of how the virus spreads, most governments are closing down factories and workplaces. Schools will eventually close as well. Worldwide transportation might grind to a halt and supply chains everywhere will be disrupted. If the virus continues to spread, a severe economic contraction seems unavoidable to me, and it could result in equally severe socio-political unrest from populations that feel that their governments were ineffective and incompetent. And if that happens, then COVID-19 might end up being one of the most significant events of the last 100 years. Now, I will continue to follow this story closely, and along with other videos I make on medical subjects, I will continue to make easy-to-understand updates on COVID-19 on my channel. So please subscribe if you'd like to hear more from me. Please put any questions or comments that you have in the comments section, and we can continue the conversation over there. As always, thank you so much for listening, and I will see you all in the next video.